Now it's the holidays. Women especially are trying to juggle it all, and we may be more susceptible to getting sick with respiratory virus cases climbing this time of year. Dr. Renee Argubano of Clifton Park Family Practice is here now with some insight. Doctor, thanks so much for coming in.
Thank you so much for inviting me. It's my pleasure.
It is a crazy time of year, as you know, for everybody. Stressful. Women especially may feel overwhelmed right now. We know that stress doesn't help when it comes to illnesses. How does it put us more at risk?
Oh yes, stress, not sleeping, thinking of so many different things, that puts us at risk. So remember, when there's infection, there's infectious agent and the susceptible host. And that's the good thing. I mean, not good in a way, but that's the reason why we get infection. We become susceptible. So we, the human being, especially women who are so busy, we need to keep ourselves healthy.
Our defenses are down, certainly this time of year, and we're running around. Let's talk about what we can do to try to help ourselves, to try to avoid getting sick. We know the germ is the big thing here, but what are some of the ways we can hopefully avoid it?
Yes, so we talk about hand washing, you know, those are basic. Immunization, these are important, but there are more, you know, with that, you know. So we have to build our immune system. So this is not just this winter, this is not the way it is. We should build our immune system.
Yeah, all the time.
We should nourish our body, eat healthy. We need to drink a lot of fluids. We need to be active, exercise. We need to sleep. Even we're so busy, we should not forget sleeping, okay? Because that's the time our body heals. And also we try to avoid toxins like smoking, you know, drugs, too much alcohol. These are not good for our body.
And it's funny because this is the time of year where all of those things seem to happen, right? You don't get enough sleep, there are parties, there's alcohol, all those things you shouldn't be doing. It's harder to eat right, but these are things we should keep in mind, so hopefully we can stay healthy. I know in your office you're seeing all those respiratory illnesses right now.
Yes.
COVID, flu, RSV. What are you seeing the most, or is it really a mix?
Oh, it's a mix. And there are also, besides COVID, flu and RSV, we have other viruses.
Sure.
We don't even think about them, but we do have a lot. Parainfluenza, adenovirus, rotavirus, and others.
So vaccines, you talked about them. Let's say that you haven't done it yet and you're thinking, I'm going to be with the family coming up in 2 weeks. It's still worth it though, right? I mean, can you build that immunity in that period of time, or at least build some of that immunity? And to be clear, doesn't mean we're not going to get sick, but how does it help us to be vaccinated, even because we know we can still get sick?
Yes. So remember, we have vaccines that are seasonal, and we're talking about the flu vaccine, the COVID vaccine, and the RSV. So yes, we still have time. For those people who have not been vaccinated, we still have time. See, the flu season goes until like March.
Right, yes.
And we see patients until March, April with flu. And COVID is always there, so please, you know, get vaccinated. And how it helps us is, see, we cannot kill viruses, okay? So the vaccine is the best way of protecting ourselves because we developed antibodies against them. So we are so lucky we have vaccines for these viruses. Not all viruses we don't have vaccines for all viruses.
You can cut down on the severity of the illness, right? Because so often people say, well, I could still get COVID even if I get vaccinated, but the goal is you hopefully don't have a serious case.
So we are lucky we have vaccines for COVID. Remember, it is a family of a common cold, but get, you know, bad. And so we do not develop full immunity with this. At least we have the vaccine to help us prevent
make a difference,
a bad outcome.
Dr. Argubano, thank you so much for coming in. We can all do what we can, right? And hope for the best and try to stay healthy and enjoy the holidays. Appreciate you coming in. For more resources and to find all of our Women's Health Wednesday segments online, you can go to our website, news10.com. Look for Women's Health under the Community tab. We'll be right back.